Good evening. Concerns about a virulent outbreak of the measles is sweeping the Pacific Northwest. Dozens of cases have been diagnosed in Washington, and it's also been reported in Oregon. Now, some are concerned about the measles making their way to California. 23 ABC's Amanda Mason spoke with local health experts about the contagious illness and how you can protect yourself and your family. Amanda?
Yes, Jess, even though the health department has confirmed that there are no current local cases of the measles, I spoke with a local doctor who says it's a good time to check your records to make sure you have the proper vaccinations.
Measles is a highly contagious virus that can cause permanent brain damage and in some cases can be fatal. It is spread through the air and by touch. If someone breathes in the contaminated air or touches an infected surface, then touches their eyes, nose, or mouth, they could become infected. Almost 2 weeks ago, Washington State declared a state of emergency in response to the measles outbreak.
What's happening in Washington State is their immunization rates are dropping because they still have the exemption for personal reasons, and for that, more and more people become less vaccinated. Once that immunization rate drops below 92%, you lose the herd immunity and you start getting outbreaks like this.
According to the National Conference of State Legislators, California, Mississippi, and West Virginia are the only states that do not allow parents to opt out of vaccines for religious or personal beliefs.
Majority of these cases are from people who choose not to vaccinate.
The Center for Disease Control says if a person gets vaccinated as a child, they shouldn't have to get vaccinated again.
But if you get one dose at 12 months of age and you get one dose at 4 years of age, that should confer lifetime immunity. You look back in your records and you only have one measles vaccine, you should probably get that second dose as a booster.
Dr. Fan says symptoms are similar to the common cold: runny nose, cough, fever, and even pink eye. Other symptoms include tiny white spots in the mouth, followed by a rash that progresses from head to toe.
If for whatever reason parents suspect that their child's been exposed to measles, like they're coming back from Washington State or from Oregon State, and they suspect that, we encourage the parents to not just show up in ERs or in clinics unannounced. They should call ahead so there's some kind of preparation so we don't expose that person to more people.